CPT JJ-CPV Evaluation and Management E&M Services Guidelines, page 4, part 9. Okay, so new and established patients, we are reviewing the criteria for just naming a patient a new or established, right? So in this case, in the instance
where a physician qualified healthcare professional is on call for or covering for another physician qualified healthcare professional, the patient encountered will be classified as it would have been by the physician qualified healthcare professional who is not available.
Okay, all it says here is if your doctor doesn't see you but somebody who's covering for him, then the situation is treated as if your real doctor was seeing you, right? So if you're established patient because your real doctor is seeing you, you're also established patient because the covering doctor for your doctor is seeing you, which means that a covering doctor fills the same role as your real doctor. That's all it says. And now there we have a little graph for new established patients in a school setting, right? A patient presents to the nurse with a headache. And then the staff is doing data entry, should look at label to determine if it's a new patient or established patient. Then enter the correct office visit and then mark through other visit. Okay? So that's our theory for today. And now we're going to do a problem. So ready, set, go. All right. The problem is CPT JJ-RVA, page 260, exercise 89, and this is a level 2. Can you change that? It's a level 2 because there's a little difficulty there. Level 2, excision, bladder tumor, cystoscopy. Okay? So the problem reads?
Surgery, urinary system. Excision of 2.5 centimeter bladder tumor with cystoscopy.
Okay, so this is the excision of the cutting out of a 2.5 centimeter. They give you the size of a bladder tumor. The bladder, you know, is the bag that contains your urine, and the tumor has developed there. And they're using a cystoscopy, which is an instrument that they insert through the urethra all the way to the bladder to see, or in this case to cut, right? That's our procedure, and now we're going to count to 3 so you can give us the CPT code for this procedure. Okay, so 1, 2, 3. All right, the answer is 52,235. Did you get that? 52,235. Now if you got that, congratulations, you just can go to the next one, next video. If you didn't get it, let's give you a few tips. Okay, first tip.
Level 2 difficulty. You can be misguided by index. Read tabular properly.
Yeah, if you just go by the index and you don't read in deep, you can be misguided to the wrong code, okay? So be careful there. Okay, the second tip.
Start with bladder tumor.
First go to the B for bladder, right? And then from there go to the T, tumor, right? In the index. Now, tip number 3.
Cystoscopy and cystourethropy are exactly the same thing.
Right. The cystoscopy is just a short way to saying cystourethropy because the scope is inserted through the urethra and up to the cysto, which is the bladder, right? So cystoscopy, because there's no other way to insert the scope than through the urethra. So cystourethropy is the same thing as cystoscopy, okay? And in order to prove to you, we have put a link there that you can go and they treat both things as exactly the same thing. Okay, tip number 4.
If you choose excision in tabular, you'll read that this excision is part of a cytotomy.
Cytotomy, right? So if you go, the misguided part is here. When you go to the index, there's an option for you to choose excision of bladder tumor. And then you say, well, this is what the text says, so I'm going to choose this. No, don't do that. Because if you read in the tabular, you realize that this excision is part of a cytotomy, which is not a cystoscopy. Cystoscopy is done with a scope. Cytotomy is cutting or an invasive procedure, right? they cut your body to get into the bladder. This is not our case. It's done with a scope, right? Which is not our case. Then you choose the other options, and although it's not exactly what it says, but when you go to the tabular, you will read that this was the right option. That's why it's level 2. Okay. Now, in order to understand the problem, as usual, we have 4 A+ links that you can watch those. Please watch those, and you will know exactly what we're talking about. And if you're a little further interested, you can have the other links. And then the answer you already know, which is 52235. Okay, you have all the information for you to get to this problem, right? So we're going to count to 3, so you can pause the video and then give us the path, how we got to the problem, or the answer, right, of this problem. So 1, 2, 3. Okay. This is the summary of the whole problem. This is the surgery section of the CPT book manual, and it's a urinary system. It's an excision or a cutting out of a 2.5 centimeter bladder tumor with cystoscopy. Okay, it's excision with cystoscopy. That's the point. It's not with a cystotomy. You don't cut the body to get into the bladder. You just insert a cystoscope. Okay, so there's only one code, and the code 1 through the index is found like this.
First you go to index. Then you go to bladder.
Go to bladder, to the B for bladder. Then you go to?
Tumor.
You go to tumor, right? And then is when you have to choose resection, right?
Right.
Don't choose excision. Why? Because if you go to the tabular description of excision, it means that excision is part of a cytotomy, and this is not our case. So choose resection. Trust us. Choose resection. Right? So there's a range of codes right there, right? So we're going to examine those codes. So you go to the tabular, right?
Right.
And we're going to examine the first code that they give you, right?
Right.
Like this.
First you go to tabular.
Go to a tabular.
Then you go to 52234.
Which is the first code that they have given us in the range in the index. And what is that?
Cystoscopy.
Now, remember that we told you that a cystoscopy is exactly the same thing as a cystoscopy, right? Which is what we have, right? But this is for what?
Small bladder tumors.
This is for small bladder tumors, and they give you the range from 0.5 to up to 2.5 centimeters. That's not our case. Our case is 2.5. So let's keep reading. What's the next one?
52235.
Which is the same thing, right?
Right.
It's the same description as cystoscopy, but now this is a medium, right? Bladder tumor. And the range is?
2.02 to 5.0 centimeters.
And our tumor is 2.5, so it falls here in this range, right? So that should be our code. But let's examine the next one.
52240. Large bladder tumors.
Large bladder tumors, right? So this is for tumors that are even bigger than 5 centimeters, right? Since this is not our case, we go back. This double forward slashes means go back to 52235, which is that, and an equal sign means that that is our code. So the answer will be 52235, right?
Right.
Thank you. So we got the answer, and we invite you to visit our website, and also
you can subscribe to us in YouTube by clicking here for our new medical coding videos.
just click in the subscribe button and you will get
up to 3 videos every day that we make. ICD-10, CPTs, all that's needed to pass the medical coding certification exams.
So don't forget to visit our website and subscribe to our videos. Thank you.
Goodbye.
Bye.